Acetylcholine is a substance in the brain that is involved in cognition, which includes memory, reasoning, communication, understanding, and overall function. Cholinesterase is another substance in the brain that breaks down acetylcholine. When acetylcholine is broken down by cholinesterase, the lack of acetylcholine doesn't allow the brain to store or retrieve memory the way it normally would. The Exelon patch provides patients with rivastigmine, which is a type of medication called a cholinesterase inhibitor. This means that when rivastigmine travels in the bloodstream to the brain, it attempts to block the effects of cholinesterase on acetylcholine. The Exelon patch is indicated for the treatment of dementia due to mild to moderate Alzheimer's disease. It uses transdermal or patch technology to provide rivastigmine, which means it releases the medication through the skin and into the bloodstream continuously for 24 hours. The Exelon patch demonstrated efficacy in overall function and cognition at a dose of 9.5 milligrams per 24 hours, and demonstrated improvement in instrumental activities of daily living, such as performing hobbies, focusing on conversation, and using the telephone, at a dose of 13.3 milligrams per 24 hours versus the 9.5 milligram 24-hour dose. The Exelon patch does not change the course of Alzheimer's disease. The patch is visible on the skin, and the date of application may also be written on it as a reminder. Exelon patch reduces the number of pills your loved one has to take each day and provides another option if he or she has trouble swallowing pills.
Indications. Exelon patch, rivastigmine transdermal system, is a prescription medicine used to treat mild to moderate memory problems, dementia, associated with Alzheimer's disease. Exelon patch is also used to treat people with mild to moderate memory problems, dementia, associated with Parkinson's disease. Important safety information. Exelon patch should not be used if the patient is allergic to any component in Exelon patch, including the active ingredient rivastigmine, or has had an allergic reaction to a similar type of medicine. There have been some cases of skin reactions, e.g., rash, itchiness, and hives, that extend beyond the site of patch application. Speak to the doctor before using Exelon patch. Mistakes in using Exelon patch have resulted in serious side effects. Some cases have required hospitalization and rarely led to death. Most mistakes have involved not removing the old patch when putting on a new one, and the use of multiple patches at one time. Only one Exelon patch should be worn at a time. If you accidentally apply more than one Exelon patch, remove all of them and inform the doctor immediately. Exelon patch can cause gastrointestinal adverse reactions, including significant nausea, vomiting, diarrhea, decreased appetite, and weight loss. Dehydration may result from prolonged vomiting or diarrhea and can be associated with serious outcomes. The incidence and severity of these reactions are dose-related. For this reason, treatment should be initiated with Exelon patch at a dose of 4.6 milligrams per 24 hours and titrated to a dose of 9.5 milligrams per 24 hours if appropriate. If you have not taken Exelon patch for more than 3 days, do not start taking it again until you have talked to a doctor. The most common side effects with Exelon patch 9.5 milligrams per 24 hours were nausea, vomiting, and diarrhea. The most common side effects with Exelon patch 13.3 milligrams per 24 hours were nausea, vomiting, fall, decreased weight, application site redness, decreased appetite, diarrhea, and urinary tract infection. Weight should be checked while the person is using Exelon patch. Weight loss, loss of appetite may occur. People below 50 kilograms, 110 pounds, may experience more side effects and may have to stop using Exelon patch due to these side effects. People at risk for stomach ulcers or who take certain medicines should tell their doctor before starting Exelon patch, because serious stomach problems, such as bleeding, may occur. Exelon patch may cause fainting or slow heart rate. People with certain heart conditions should tell their doctor before starting therapy. People with serious lung conditions and difficulty breathing, bladder problems, or seizures should consult their doctor before using Exelon patch. Extrapyramidal symptoms, e.g., uncontrollable facial or body movements, including tremor, restlessness, could occur or get worse. Parkinsonian symptoms, particularly tremor, have worsened in Parkinson's disease dementia patients treated with Exelon, rivastigmine tartrate capsules. People on Exelon patch who feel dizzy or drowsy should not drive or use machines. Tell the doctor about all other prescription or non-prescription medicines the patient is taking. Exelon patch should not be taken at the same time with other medicines that have a similar effect on the body and the brain, cholinergic agents, or with anticholinergic medicines. Inform the doctor if the patient needs surgery requiring anesthesia while using Exelon patch.
Be sure to review the full prescribing information for Exelon patch included with this DVD. In the next chapter, we'll discuss how to apply the Exelon patch and things you need to know about helping your loved one during treatment.